Thank you so much, Mr. Rodrigo. This is really a very great insight. Using a population like Brazil with its vastness, the infrastructural challenge, and the enormous investment required to overcome this challenge. First and foremost, getting the cold chain in place, and also crossing over 5,000 municipalities. This is a huge and enormous logistic challenge. And also, it's very impressive to hear of addressing inequalities by prioritizing the indigenous population. Really impressive. Thank you very much for those deep insights. I would turn over to Mazur to get similar insights from your operations as a managing director, ready to respond.
Yes, thank you. Thank you, Ben. Thank you for having me. I represent today Ready to Respond. Ready to Respond is a unique global collaborations of partners from the public, private, and non-profit sectors, which is committed to augmenting low and middle-income countries' readiness to respond against influenza and emerging respiratory viral pandemics, such as COVID-19. And I just want to remind ourselves that the title of this symposium is Lessons to Inform Pandemic Influenza Response. So you won't be surprised that I'm trying to connect the dot of COVID-19 to the influenza vaccination programs. Ready to Respond was launched in 2020, just at the beginning of the pandemic, with support from WHO, the US CDC, the Task Force for Global Health, the Wellcome Trust, IFPMA, which I know is going to present later in the day. A few vaccine suppliers from the private sector have joined, and the Sabin Institute, with the agreement that its coordinated work plan would focus on advancing global pandemic preparedness through the promotion of country-specific seasonal influenza vaccination programs in low and middle-income countries. The truth is that the most recent analysis from IFPMA shows that 49% of the world population receives only 5% of the produced free vaccine doses. So even during interpandemic, there is an issue about access, supply, and demand of flu vaccines, which has been to date used as a blueprint for influenza pandemic preparation. 18 months ago, we conducted a survey among WHO member states to try and understand why influenza vaccines are woefully underused in low and middle-income countries. Not surprisingly, and this is actually everything which has been discussed today, there are many issues relating to vaccine access. It's a big bucket of issues regarding regulatory complexities, supply and demand management, including procurement issues, insufficient logistics, and unreliable cold chain. 12 months ago, the World Bank, the WHO, Gavi, and UNICEF led a readiness assessment at the beginning of the pandemic of COVID-19, over 100 low and middle-income countries, and they showed that only half of the countries had the cold chain capacities needed to deploy the vaccines. So what Mr. Cruz mentioned now, I just wanted to highlight it as one of the elements I would like to focus on now. The one element I would like to focus on is cold chain capability. Currently, there is a very slow trickling of the COVID-19 vaccine. We know that the number of doses which have trickled through COVAX is extremely low. I think it's about 70 million doses, which is 40% of the target for this week, which is really minuscule compared to the 1.5 billion doses which have been made available around the world. So this trickling has not really required, at the moment, massive cold chain upgrades in low and middle income countries. But when this volume will increase, and we heard in the previous panel that it is deemed to increase in COVAX and companies are increasing their supply, some of these low and middle income countries will feel a crunch. About 60% of healthcare facilities in low and middle income countries lack reliable electricity, which would be necessary to power vaccine storage. In sub-Saharan Africa, a quarter of these facilities do not have electricity at all. So Gavi and UNICEF have stepped up to the plate, buying thousands of off-grid ready solar refrigerators for last mile delivery in 50 countries. But that is not enough. We need a long-term solution. The issue of affordable, reliable, sustainable, and modern energy to all is one of the sustainable goals. and it is a problem that requires intersectoral solutions between energy and health. We believe that long-term solutions are needed, and this pandemic presents the opportunity for countries to establish this long-term solution, potentially with financial support. I know that the World Bank had expressed interest in funding this investment. We believe that such structural improvement coming out of the COVID-19 campaign will address one of the issues that the survey we did a year ago outlined, which is implementing annual influenza vaccination rollout thanks to improvement in cold chain. And the second issue that was raised in the previous panel, I want to insist again on the issue of proper planning, on having a robust vaccine supply and demand planning process at country level, not only at the supplier or the government level, but we need to understand exactly what are the needs long term. Some published estimates show that several low and middle income countries will not meet their COVID-19 vaccination targets before the end of 2023, well after high and upper middle income countries have been able to immunize over 60% of their population. This is terribly late when you think that people are now talking about the disease remaining endemic and requiring booster doses because of variant. Planning for this potential extended demand needs to be addressed at country level. That was one of the barriers identified in our survey. We identified that even for influenza, there is a weak alignment between supply and demand of these influenza vaccines. Influenza vaccine demand, when expressed by some countries, is not reliable or is stated far too late in the manufacturing cycle. This is a barrier that can be addressed at country level by providing demand forecasting support to vaccine program managers so that vaccine suppliers can plan and sustain additional vaccine capacity for these markets, and so that distributors and logistic partners can adjust their strategies to these specific needs. I will stop there and maybe come back to this point later.